Hello, everyone. Welcome to my Women's Health and Fertility podcast with Dr. Tina Yang. Today, I am excited to introduce a very special guest. Her name is Elaine Kopinga, and she is a certified nurse midwife and women's health nurse practitioner. She is the founder of Obaton Women's Wellness Collective, and she truly has a novel approach to care where she melds the practices that have worked for women for centuries with modern, evidence-based research. She was born in West Africa, and her mission is to provide caring and loving African wisdom to women everywhere. She is excited to bring a combination of this ancient wisdom and modern science to her clients and offer full spectrum concierge, maternal, and postpartum consulting services. Welcome, Elaine, and thank you for being a part of our podcast. We would love to learn more about your practice and the services that you offer women in the postpartum world, as well as in the healthy weight loss region as well.
Thank you so much, Tina. So I apologize. I'm just getting over a little bit of a cough, so you might hear me coughing through this interview. But no,
No
I
problem.
am really excited to be here. I am such a believer in integrating Western and Eastern medicine. So just being able to be here and speak to you is an honor. So thank you for having me. Um,
Oh,
my practice, I'm a certified nurse midwife and a women's health nurse practitioner. And I started my practice a little over 4 years ago, really because I noticed that after patients were giving birth, what was really lacking was that what we call that fourth trimester, right?
mhm.
They would come in to see me for their postpartum exam. I would see them at the 6 week mark because this was before ACOG finally came out and said, yes, women should be seen, a little sooner. And I would see them at 6 weeks, and by then they were frazzled, stressed. It was almost like they were kind of not beyond the point of no return, but it felt that way for them. And sometimes it felt that way for me during our visits. And so I thought, I'm from Ghana, West Africa, and there's a really specific way that we do postpartum. And I wanted to share that experience with um, people in America. And so that's how my practice started. So we focus on providing really traditional postpartum care. And when I say traditional, it's kind of a blend of traditional West African postpartum, traditional Asian postpartum, and then
Mhm.
also more traditional Latin postpartum care. Um,
That's
and then,
amazing. Yeah, I
thank
love
you.
that.
Thank you. And then through that, I also started working because I'm a women's health nurse practitioner and I work with women in hormones and menopause. Weight loss was just a really natural progression. I had done weight loss. I've been doing it for the last 10 years. And so it was a really natural way to weave that into my women's health practice as well.
Well, I love how you're capturing all phases, right? So women are coming in for pregnancy support and then postpartum care, and then you're like, okay, now I want to recover and get back to my old self again, or as much as I can, and then of course going through the transition of perimenopause and menopause. So um, I love that, and our practice is very similar. Actually, we definitely provide care through all of those phases. And it's just wonderful to kind of grow and develop with your patients and be able to support them and help them be the best versions of themselves through all of these
Absolutely.
changes in life.
Absolutely.
So that's awesome. So I know that you provide services. Would you be able to share a little bit more about specifically the postpartum care services and then also the weight loss services that you offer?
Sure. So, it took me a while to kind of evolve into, or took our practice a while to kind of evolve into what kind of postpartum care do we really want to provide. And, at first, when you're starting a business, you kind of want to catch everybody. And I finally had to get to a point where I said, no, this is who we are. This is what, my vision is and what I'm passionate about. So what we do now is we offer really tried and true traditional postpartum confinement, meaning the postpartum specialist comes in for 30 days, and it's a 24/7 care, and it's very purposeful. So that first week, it's focusing on the mom and focusing on her nutrition in a really key way. So she's drinking soups, specific like bone broth.
Mhm.
She's not eating the cold food because the goal is to really replenish that volume loss that happened during birth. And also she's choosing to breastfeed to really help that milk production. And then the second week is, we add a new layer of foods. It's really, when you look at it, you're focusing on like soups for hydration and protein to really help to restore the body, right? We do very specific lactation work on the breast, just a very specific massage to help that milk come in and also to help prevent
Mhm.
mastitis and plug ducts. We also do specific massages for the womb to help it um, you know, uh, remain firm to decrease bleeding. And then there's care for the baby. So it's a really robust plan. And, a lot of Americans are not used to having someone live with them 24/7. So I would
Right.
get a lot of requests for, well, I just want nights and I just want this day or that day. And I would try to accommodate it. And when I just realized that's not what our vision is to really allow you to rest, bond with your baby, bond with your family. And so that's the care that we provide.
I think that that's an incredible service. I hope more women take advantage of that because I don't
Mhm.
think you realize when it's having your first baby, I don't think you realize what's all entailed. Not only are you recovering, depending on what kind of labor and delivery you had, plus, you're trying to like really incorporate this new being into your life that
Yes,
a lot of requests and requires a
absolutely.
lot. So this is very similar to what in our culture, in the Chinese culture, your mom moves in with you
Yes,
basically,
absolutely. Same
stays
with
with you for
African.
30 days, yeah, cooks, cleans, does your laundry, takes care of the baby, makes Chinese herbal decoctions for you. So I was really grateful that I was able to have that for both of my kids, both of my children, and my postpartum care support was like next level. But I know that that's really hard to find. And a lot of folks out here, their parents live somewhere else, maybe another
Right.
state, another county, another country sometimes too. So
Yes.
I think that what you are offering is incredible and it is in very, very high demand now. And I think that, I think as Americans, we are in culturally, we kind of have this like, I'm superwoman, I can do everything, which is fabulous. Professionally,
Yes,
it's great. But I think that when you have a baby and when you go through the birthing process, it's such a vulnerable time.
it is.
Right? And like you don't even realize, wow, this is like really takes me back to like my most
Yes.
vulnerable being. And so
Yes.
having that community and that support is so important. And I know that my recovery after having my two kids was so much better because of the support I had from my moms. So so as far as the postpartum care that's provided, who provides these services? It sounds like it's like a collective or a team of
So
specialists.
it is. It's a team, and it's really special. And I always butcher it because Mandarin is not easy for my tongue to the pronunciations. But
Same
I
here.
have a team of real Yue cells. I always say
Huh?
it.
Oh, no,
Um,
it's great.
Yeah, but they're like the real deal. They got their certifications from China. They're here in the States and they do everything old world, and I love it. I love it. After I had kids, my whole life changed 180. And I used to be very, if it's not Western medicine, if there's haven't been 1,000 trials on it, then I don't believe in it. And I would
Mhm.
always tease my mother because she'd say, "Well, in Ghana we do this, in Ghana." I'd say, you guys don't know. And then I had kids. I had kids, and I thought, oh my, everything she's saying, maybe they didn't know the scientific reason for it, but they knew intuitively, right, that it's important that we do, the baby massage, right? Or
Right, right.
it's important that one of the traditions in Ghana is that the father will just take a walk with the baby with that first morning dew, and just walk, and that baby feels that dew. So there's just little things that have been done in cultures all over the world that our grandmothers knew, our aunties knew,
Mhm.
um, and I just love that tradition being passed down to women today.
That's amazing. So 30 days. So what if a patient says 30 days is too long? Can I have you for 2 weeks? Is that an option?
I am trying my best to adapt things within reason to the American culture. And so the problem is I also want to think about my team. And what happens is if they book for 2 weeks, then they're missing out on being able to make income for that whole month. So
I
if
see.
I have someone that's
Right.
available that can bridge that, I'll do it. But I don't want them to lose out on making their livelihood because we only booked 2 weeks.
Right, right. And they're live-ins, right? So they're counting on that
Yes.
income. That
Yes.
makes a lot of sense. And
Yes.
and I do think like somebody might say, I only want 2 weeks, but then after the 2 weeks, they'll realize I need another
Always.
2 weeks.
Always.
So,
Always.
and if you end up booking your staff somewhere else, then they lose out on having that consistency of care.
Yes. Yes.
So yeah, so that makes a lot of sense. And I know just going through the 30-day postpartum, process of the traditional way of recovering, that it is important. And boy, those 30 days go by fast.
Really
So
fast, really fast. It's a minimum 30 days, and then a lot of clients, especially my Asian clients, will do like a 60 or 90 day, and,
wow.
and it
Hmm.
changes. So like the first month is the most intense. The
Hmm.
second, it evolves a little bit. I would say the biggest thing that I'm trying to adjust to is as Americans, we like our space, right? Our
Right,
homes aren't huge. Southern California is not, there's not a lot of space. So for a lot of people, it's not that they don't want a live-in, they're just the reality is they don't have that space. So,
right, right.
one of the biggest things that we're trying to do now is accommodate people that just want nights.
Hmm.
Um,
Hmm.
and I think that for so many people, they think that the live-in is automatically so much more expensive, and it's really not. Um, but, so that's one of the things that I am trying to accommodate is that because we just don't have the space, trying to accommodate just nights for that 30 days. But then I feel
Right.
bad, like, you're missing out on all the great things you could be having during the
Sure.
daytime. Yeah.
So I think that's great that you're looking at different ways to still provide that fourth trimester support and,
Yes.
and meeting your patients where they're at and what they're able to do
Yes.
in their current life. So
Right.
as far as the soups, are these Chinese herbal soups? I'm so curious about what is being cooked and decocted and
Yes, the majority of it is Chinese herbal soups. Again, every once in a while, I'll have a patient. I think they get a little nervous, like, well, can they make Western food? And I say, they can, but once you have the soup that they're making, you'll realize it's
hmm
flavorful. It's very similar to what you're used to.
hmm
Um, if I do, there's a small amount of Latina postpartum doulas that I work with, and they will make something that's a little bit more traditional to the Latin culture.
okay,
And then
that's great.
if it's more of an Afro Caribbean postpartum specialist, then they'll make a soup that is closer to that. But I don't think people understand that they're all very similar.
Hmm.
They're all it's if the base is a protein and then soup and then herbs that are gonna help with, firming the uterus, helping that lactation production. So all of these cultures are much closer linked than we all realize.
Yeah, I think that's incredible because, some of the stuff that we cook afterwards is, it's a lot of bone broths,
Yep.
blackened chicken with
Yes.
Chinese herbs that tonify the qi, tonify the blood. You may have heard of this formula. It's called Shen Hua Tong. It's called, the translation is like transform the blood. So it helps
Yes.
to tonify and move the blood as
Yes.
well as remove any like residual lochia or anything that hasn't been completely discharged from the uterus. And so that's usually given to you, like it's cooked for you for the first week after you
Yes.
deliver. So luckily for us, we have it in a capsulated form now for those that do not want
Amazing.
to cook on their own. So,
Amazing.
but even better that you have these specialists that are doing the cooking for your patients. That's amazing.
Yes, yes, and that I'm glad that you brought that up because one of the things we're also looking at is how do we offer just the meals, right? So if someone doesn't,
Mhm.
maybe their mother is staying with them or they have a care, but they do want to have the soups and the meals that first week or the first couple weeks. How do we then supply them with just the meals for that? So there's a lot of fun new things that are happening.
Yeah, that I can't wait to see how that all works out, all the different facets of your services. So tell me a little bit about your in-office and your virtual services. I know that you offer a wide variety of services around pregnancy support and postpartum care and weight loss.
Yes.
So I'd love to learn more about the offerings that you provide your patients.
Sure. So I think the number one thing that I provide for pregnant patients in office would be the like prenatal education. So for people that are planning to get pregnant, preconception, that are pregnant,
Mhm,
or that have had a baby. It's a lot of education. That's a big
mhm.
thing that I do in the office. So if someone wants more of and I think this was really birthed through COVID and it's just kind of stuck. If someone wants like a prenatal course, but they want it more tailored to their lifestyle, I do one-on-one, and I can do that in the office or I can do it virtually. And then I
Nice.
do a prenatal course out of my practice here in Newport Beach once a month. So I
And
rent
these are
space
live
from
courses?
live courses. Yes.
Okay.
Yeah.
It's nice
Live
to have the
courses.
option of
It
virtual
is.
and live. I think some folks are kind of tired of being on the screen,
I
being on
agree. I
computer.
agree. And I also think that what's nice is that because when we do the live courses, there's other people. So you
Mhm,
automatically get a cohort, right?
mhm.
Other women that are delivering around the same time that you are. They exchange information. And so you build that community already from day one.
And you said this is offered once a month?
Once a month. Yes,
Once a month. Okay, you'll have to let us know when your next
absolutely.
course is, so you can make sure to share with everybody. And then as far as timing, when's the best time for a pregnant woman to start care with you?
Anytime, honestly, because again, what I do is so much more on the education side. And really, I like to tell people I'm your pregnancy concierge.
Mhm,
So, anything and everything that you need in pregnancy, there's a really good chance that I could help you attain that or get that. So
mhm.
I get anytime. If you are looking for postpartum care, sooner is better because our team books up so far in advance. And so I always tell people even if you're thinking about it, let's have a conversation because I want to find out what your needs are and really pair you with that best person.
Okay, great. I'm really asking these questions so I know when to refer patients to you
That's
and
perfect.
so that
Appreciate it.
they can get on the schedule in a timely fashion. So as far as learning more about the services and seeing if it's a good fit, do you offer like discovery calls or
Yes.
complimentary consults? Okay,
Absolutely,
great.
absolutely. So people can reach out to me via my website. They
Mhm.
can call me, they can text me, and I always do a discovery call. And I haven't gotten very good at making them efficient. I think I spend a lot of time with people on that first call just because
Mhm.
um, I'm okay with giving out free advice. So
Yeah,
I'm
well,
sure my
it's such an intimate relationship, and I think being able to spend time with somebody that's that's going to be such an integrative part of your pregnancy and your postpartum. So that's wonderful that you're able to spend the time with the patients, and I'm sure they all end up being your patients because you're
some do, and I
wonderful
think
and
for
you're a
some,
wealth of knowledge.
well, thank you.
Mhm.
Some do, and I think for some people who really just want that more traditional Western postpartum care, I've got great people to refer to, and I
Mhm.
I hand them off there.
Okay, I
Yes.
already am thinking about like three people that I'm going to send to you. That
Thank
are
you.
looking for the traditional, postpartum support, and, I have a couple of patients that are doing it on their own, whether they used a sperm donor or,
Yes,
perhaps they just haven't found the right partner, but they don't wanna wait any longer, and they wanna
absolutely.
start having kids. So I think for
Absolutely.
those women, your service is perfect.
Amazing.
So, yeah, so I have a couple of folks in that situation that I think would be a good fit. Okay, so I have a couple more questions for you.
Sure.
So, what about the support that you provide for fertility patients and your patients with PCOS? I know that you mentioned that hormone balancing is a big part of your practice. So, I wanted to ask about that and also how the integration of your weight loss program, or if your weight loss program is a big part of your treatment plan for those folks.
I would say for the bulk of my PCS patients, it's the bread and butter of it, and it's how
Okay.
they come to me, to be honest with you,
Hmm.
is that, they've struggled with their weight their whole life, and I think that for some reason in this country, there's this mindset where if you get help with anything, whether it's with weight loss, whether it's with childcare, that you're giving up or you're not, giving it your all. And so
Hmm.
I think pregnancy is one of those times in a woman's life where if she's struggling to conceive and if, insulin resistance or PCOS is part of that reason, I think it's the one time that a woman feels comfortable saying, I don't care if I need the help. I'm going to get the help because I want to
That's
be a
right.
mother.
Yeah, the motivation to ask for help is very high
Yeah.
when you're trying to conceive, for sure.
Yes,
Mhm.
absolutely. So I would say that's the number one reason that a lot of people find me, um, or that seek out my services, is that they want to conceive and there's an insulin resistance or weight is an issue. They've been told by
Mhm.
a doctor, lose some weight. And so, I have a lot of different tricks that I use. Some patients want a more holistic approach, so
Mhm.
we will start there, right? I'm a big believer in teas and herbs that you can drink to help naturally suppress the appetite.
Okay.
We'll look at meals or food that naturally, decreases inflammation, that naturally will help to enhance your egg quality. And it's not. I think for a long time people think, oh, PCOS is low carb, and I'm trying to. What I tell my patients is that it's not low carb. If anything, it's higher protein, right? So it's
Mhm.
kind of shifting that change from carbs
Right.
are bad to let's focus on what you can eat and what you should eat.
Sure.
Um, so that's one level. And then for some patients, they do want a little bit more help. So there's oral medications that we can use to to really help suppress the appetite, and help them stress free or less stress make healthier decisions, right? And then that goes all the way down to the GLP ones, the injections. The brand name is Ozempic or Manjaro. Those are options too for women that are looking to lose weight and that have an insulin issue or have a hemoglobin A1C that's elevated. Those are
Mhm.
great options too.
So if a patient comes in and they have PCOS and they're actively trying to get pregnant, would those injections like the Ozempic be safe?
I would not, if you're actively trying, meaning you're not using protection, you're not trying to prevent pregnancy, I would not put a patient on a GLP-1
Okay.
because if anything, it will make it easier to get pregnant, but there is an increased risk for birth defects.
Okay.
So
That's good to
what
know.
we what we advise patients, and this is also based on what the perinatalogist will say, we
Mhm.
want you to discontinue the medication at least 2 months before you try to conceive.
2 months. Okay,
Yes.
that's reasonable.
Yeah.
And in terms of what is safe, are there any medications, like for example, metformin, that would be safe for PCOS
Yes.
patients while
Absolutely.
they're actively
Metformin.
trying?
Absolutely. It's a tried and true. It's not one of the
Mhm.
new sexier medications, but
Sure.
it's tried and true. I also will put my patients on inositol. That's another one that
Mhm. Yep,
people
that's
like
great
a lot.
supplement.
That's and so but for in the medical world, metformin is probably one of the first things that I'll go to because it's going to give them that enhanced egg quality. And for many women, they will lose some weight while they take metformin as well.
Mhm. Right. Yeah, inositol is a great combination. I think the other thing that we're using a lot in the natural medicine world is berberine.
Yes,
Mhm.
yes.
For blood sugar stabilization. So for your patients that do end up wanting to go on Ozempic, how long are they usually on it?
It's different for everyone. And I'll be honest with you, I'm not necessarily in a rush to get my patients who have, elevated hemoglobin A1C or history of insulin resistance. I'm not in a rush to get them off of it. So if you go on it and you lose weight, you hit your goal, we see your hemoglobin A1C come down. I especially if you're someone you may not be type 2 diabetic, but let's say I know that you're borderline, I
Mhm.
know that that's an issue for you, right? It's a health issue for you. In the
Right.
same way that I know that someone with high blood pressure, if I take them off their blood pressure medication, it could spike back up. So I
Mhm.
think these meds have gotten a really bad rap in the media because I think that there's a belief that it's for rich people that don't want to work hard at losing weight or that are already skinny, they just want to be skinnier, or
Right,
it's for
right.
lazy people, right?
Mhm.
So, to answer your question, if I have a patient who truly has an insulin resistance issue, I put them on it, they get to their goal weight. I don't have an issue taking them down to a really low dose. And either they do it every other week or they stay on like a low dose protocol because I'd rather have someone lose the weight and keep it off then jump off the medication, gain the weight back, then have to come back on it's like that cycle of lose weight, gain weight, lose weight. That's that's hard on your body and that's that's
Mm.
that's not good for you. So it's really dependent on why were you on it in the first place.
Well, if their goal is to get pregnant,
Right.
and if they're kind of like, okay, I need to lose 30 to 40 pounds,
Right.
let's just say, for example, I'm just curious what's that timeline like for them before
Well,
they can start trying?
sure. So it's basically because you don't necessarily need to lose all 30 to 40 pounds to get
Right,
pregnant, right? Women
right.
would be surprised. Sometimes it's just losing 5% of your body weight or 10%, right? So
Mhm.
even dropping at 10 or 15 pounds, women will get their period back and
That's
that
right.
will increase their
Yeah.
egg quality. So again, and if a woman is over 35, there's so many different factors, but if someone's trying to conceive, I don't want to waste time. I don't want to waste their time.
Mhm.
So you get on it, lose enough to where, your cycle is back, get off of it, get pregnant. If you want to nurse, nurse. And then once you're done, I'll tell them, come on back and we'll
Mhm.
work on getting you stable again. Because if you have PCOS, then I know that your risk of getting gestational diabetes is high or developing type 2 diabetes later in life is higher than someone who doesn't. So
Right, right.
I want you to come back and see me when you're done with everything.
So you mentioned some of the other medications for appetite suppression. So,
Yes.
so what are those medications like? This is
Gosh,
like a whole new world for me, by the way.
yeah, no, oh my God, there's so many, and one of the ones I'm gonna talk about is one of the oldest ones, that I think also gets a bad rap, which is phentermine. It
Okay.
is the oldest
Fen-phen.
F not and I'm glad you said that because that's what happens when I say phentermine to a lot of people. They say,
Mhm.
"Oh, I don't wanna go on that fen-phen." I remember from the '90s, people were dying, and
Mhm.
phentermine is actually the oldest FDA approved oral, appetite suppressant. I think it's been around since the late '50s or early '60s.
Wow.
And it works. It still works really great. It just has gotten a bad rap, kind of in the same way that like Ozempic has gotten a bad rap. And in the '90s, they developed a combination of phentermine, which is PHEN, and then fen-phen, which is FEN, and they combined the two to become this like superpower weight loss medication. Um, and unfortunately, there were some adverse events with cardiac issues. They pulled it off the market. They've actually since taken a look back and said, we think we were a little premature. We don't think that they were responsible in the same way that we thought they were. But anyways, all of that to say, phentermine is not the same as fen-phen. And it was the
Okay.
FEN that was causing the issues, not the PHEN phentermine.
Well, thank you for clarifying that.
No problem, no problem. Because it's the first thing women say to me or any patient, they'll say, "Oh, I don't want that. I remember that from the '90s." And it's two different things.
Right, right. And I'm sure that, the media bombards us with all sorts of things. There's a lot of like fear factor around
Yes,
certain medications. So
yes,
that's good to know. I appreciate you clarifying that.
no problem.
So in terms of your weight loss program, is there any other type of treatments that you integrate into the programs to ensure long-term weight management and success for your patients to keep their weight
Absolutely.
off?
The medication is just one piece of the pie. And I always tell people it doesn't matter what you're on. If you're not, moving, if you don't find a way to move in a way that is enjoyable for you, and at the end of the day, if you're not eating the right foods, you're not going to be able to A, lose the weight and B, keep it off, right? Because actually, to be honest with you, losing the weight's the easiest part because you're highly motivated, you wanna get the weight off. It's once you lose it, it's maintaining that weight loss that's really difficult. And I'm gonna be the first to raise my hand because I'm a curvy girl and, I've struggled with that. I lose it, I gain it, I lose it, I gain it. And now that I'm doing weight loss, I understand so much more how the brain works and how the hormones work. And essentially what happens when you lose weight is let's say you were 200 pounds and you get down to 150. That's where you really should be. Your brain still thinks you're 200 pounds, and your brain
Mhm.
is still telling your body, we need enough calories to maintain that 200 pounds. So it's a little bit of an uphill battle because you've got to fight that. Your body, your hormones telling your body, nope, pump out those hormones. She's hungry. Um, and so the sooner that people can learn, how do I move to stay healthy? And what do I eat to stay healthy? The better. So that's like the foundation of weight loss is really that. And I even myself as a practitioner, I seek out other medical professionals to help me stay on track because we all need coaching, we all need support.
Mhm.
So I have my gurus that I seek out that help me stay on track. And then I'm that support system for my patients.
Nice. I
Yeah.
love that. No, I do think that it's so important to have the coaching aspect and a program to continue to follow because it's
Yeah.
really easy to fall off, right? And
Yes.
get kind of sucked into old patterns,
Yes.
childhood patterns and patterns of comfort, especially if you're under stress, if you have any type of like postpartum depression or anxiety, I think that's an easy way to segue back into old patterns of
Absolutely.
eating. Yeah, so that's
Absolutely.
wonderful. Thank goodness for programs like yours. And
Well,
I love how you have integrated such a natural approach with Western medicine when needed. And so I really admire that you're very cognizant about when you need to incorporate those Western treatments and,
mhm,
and you lean very natural too. So I think that's awesome because, so many of the weight loss centers are just prescribing, and
right.
there's no lifestyle modification support. There's no coaching. It's just like, here's the medication, good luck,
Exactly.
and that's a kind of a setup for failure,
It
unfortunately.
is. It is. And I think at many of those places you'll see that people have been on these medications long term and
Mhm.
there's no weight loss, right?
Right, right,
And so the goal is, I think that's what I love about having a small boutique practice is that it's very customized, it's very tailored, um, but it's also a judgment-free zone, right? So
right.
it's hearing that we're all different, and for some people, this weight is where they want to be, and for some people, this is the size that they feel good about, and so it's really how can I support each patient?
I love that. And what about women in the perimenopausal, menopausal phase? Because that's also another stage in our life that our metabolism tends to slow down. We tend to hold on to weight. So, and that's kind of the area that I'm seeing as my patients are, coming off of like their second pregnancy, having their last child, and moving into the early stages of perimenopause and just struggling. I'm like,
Yes,
I never had this extra
yes,
layer around my belly,
yes,
and I'm
yes.
still exercising like I always have, and I eat pretty clean. So what's happening, right? So
Absolutely. Absolutely. And I think that as far as weight loss, that's actually my favorite population to work with because the perimenopausal, postmenopausal women do so great. They do. And I don't know if it's just a matter of wiser, they've been around the block a few times, they're
sure,
not wasting time. And
right, right. High compliance.
yes, yeah. And I also think that there's a movement where people just because I'm seeing it in the postpartum where people want to enjoy their postpartum, and I'm
Mhm,
seeing this in menopause where people want to enjoy their menopause, right? Their kids are older, they've got more money in the bank, and
mhm.
they can have more sex with their partner because there's not kids everywhere. So
Right.
they do really really well, and I that's one of the reasons I love the GLP ones because I also think that they do really well for this population as well. And so um, I really have not had anyone that's perimenopausal or postmenopausal not be able to reach their goal and not feel great. I mean, I have patients that are crying with me because they just feel like this is something that they never thought that they could shake that extra X pounds. And
Right,
they
right.
finally done it. And what it's done for their mental health and their confidence in the bedroom or in their
Mhm.
dating life, they feel great. And I'm here for it.
That's amazing. And what
Yeah.
if women are like, I don't want to do the GLPs, I don't want to do the Ozempic?
There's a million other things we can do.
Okay,
A
great.
million other things. And there's that and that's the thing, when it comes to weight loss, there's not just one size fits all.
Hmm.
There's something for everyone, right? And I think it's just shedding that judgment that if you're asking for help, it doesn't mean that you're lazy. It doesn't mean that you don't know how to do it. There's just some people that have more food noise in their head, right? Their
Hmm.
bodies just pump out more food noise. So how do we quiet that so that you can focus on your workout, so that you can focus on the food that you like to eat that's good for you? You're just not constantly thinking about how to be healthy for that next meal.
Right, right.
Yeah.
Yeah, and get yourself out of your head sometimes and
Yes.
just yeah, and out of that negative thought pattern too.
Yes. Yes.
So that's huge. That's a huge part that I see in a lot of my patients too, is just, really being so hard on ourselves and
Yes.
self-deprecating too as women. And we kind of like, we want, we think and feel that we have to do it all. We have to be, the perfect size, the perfect mom,
Right.
the amazing career woman. So I call it the superwoman effect.
Absolutely. And I think the United States is the biggest offender because, um, on one hand, we'll say, well, you just had a baby, don't worry about losing the weight. But then on the other hand, we're really looking at you like, have you lost the weight yet? And one of the
Mhm.
things that I love about when I look at traditional Chinese postpartum care, and throughout Asia, I mean, gosh, they're so honest. It's like, "You've had this baby, let's take care of you, and you know what? Part of that is you wanna look good and feel good after you've had this baby, so let's start the steps to do that," right? And if it's drinking, bone broth or teas that are gonna help you, like, flush out some of that excess, water that you're retaining, if it's binding your belly, if just little things that we can do to help you start to feel like you're on that path, we're gonna do
Mhm.
that. And I love that honesty because I think that in my culture, it's very honest, right? Like, probably too honest, but it's okay it's okay to be honest and say, I've had a baby, and I do wanna look good and feel good, after having that baby."
Yeah, absolutely. We should embrace that, and
Absolutely.
embrace the inner needs that we have for ourselves as
Yes,
individuals and as new moms or second or third time moms too.
yes.
So, Elaine, thank you so much for all of this amazing information you've shared today, and I really have learned so much from you. Do you have any advice that you'd like to share for women that are coming into motherhood or recovering from delivery in their fourth trimester and beyond?
I everyone says enjoy it, and I absolutely want people to enjoy it, but I think that the reality is sometimes when your hormones are all over the place and you're stressed about being a good mom and you're stressed about finances because babies are expensive, you're stressed about going back to work, but you don't want to, but you do, it's hard to enjoy it. So I think that just kind of piggybacking off what we were just talking about, I think just being honest with yourself about what it is that you really want. And sometimes what you really want is what I wanted. I wanted to be working 100% and I wanted to be home 100%. And
Mm,
so,
mhm.
you can't do that, but then you kind of have to go backwards and say, how do I achieve that desire or that feeling that I'm looking for? Um, and I think, it took me 6 years to lose the baby weight, right? Because I think I wasn't honest with myself about what I really wanted or needed. So I think the number one thing that I'm going to say is be honest and surround yourself with people that will help you build that village and build that community to achieve your goals. It doesn't mean you're selfish. It doesn't mean that you're a bad mom. I think the sooner that you can take care of yourself, you're going to be so much better for your family.
Amen. I totally agree. And finding that sweet spot for yourself too of work-life balance.
Yes.
I think
Yes.
that's really important. There's a lot of that guilt, the mom guilt, but
Yes.
I think you said it perfectly in that, when you are happy, fulfilled, and balanced, it makes you the best mom possible and wife too.
Absolutely.
So,
Absolutely.
okay, one more question for you, Elaine.
Sure.
Any upcoming events, workshops, or talks that you'd like to share with us?
Oh my goodness, let's see. I just finished a pelvic health course with Dr. Dubinskaya. She's a urogynecologist and expert in pelvic health. And it was about, again, integrating Western medicine and Eastern medicine and just the two different cultures. So definitely check that one out if you're interested in learning, whether you're a mom or a healthcare professional. That was a great course. Um,
Is that
we
available through your website?
It's not available through my website. It will be. We just have to kind of finish all of the editing, but
Okay.
it was recorded, so that link will come out.
Well,
Um,
definitely send it to me and I'll add it to the show notes for sure.
Thank you, thank you.
Mhm.
And then I am also in the process of developing a program for doulas, newborn care specialists, nurses, anyone who wants to do more work in traditional postpartum care, and offer that traditional confinement care. So that'll be coming out soon as well.
Incredible. I am so excited for all these new programs and education courses, and definitely keep us updated on all of the new amazing things you're offering. It sounds like you're offering for patient care as well as for practitioners.
Yes, yes,
Okay.
absolutely,
All right.
absolutely.
Thank you again, Elaine,
Thank you
for
so much for
making the
having me
time
on.
for us. All right. Thank you so much.
Thank you.